The Truncus arteriosus is a congenital cyanotic heart disease which results from a failure of a septation of truncus. As a result, there will be a single arterial trunk arises from heart with large VSD immediately below the truncal valve. What we mean by this statement? In normal human body, embryologically, the heart is drained by a single arterial trunk. During 3 to 4th week, this single arterial trunk is divided by aortopulmonary septum and divide this arterial trunk into pulmonary trunk and aorta. The pulmonary trunk carry the blood from right heart, mean that it carry the deoxygenated blood, while the aorta will drain the left heart and will carry oxygenated blood. Embryologically, when there is a failure of formation of the aortopulmonary septation, mean the arterial trunk fail to divide, it will result into a truncus arteriosus. So as a result, there will be a single arterial trunk arises from heart which contain both oxygenated and deoxygenated blood. As a result of this pathological process, the heart in truncus arteriosus will look like this. There will be a single arterial trunk arises from heart and immediately below the trunk there will be a large VSD. Now a question arises that how a lungs will get its blood supply. The lungs will get its blood supply by two mechanisms. The first one is that this truncus arteriosus later divided into a pulmonary trunk which supply the right and left lung. But sometimes it do not divide and the lungs get its blood supply from directly from aorta by two of its branches. So it is all about the pathological process of truncus arteriosus. Now come toward the clinical finding. The clinical finding in truncus arteriosus will depend on pulmonary blood flow, which will ultimately depend on the truncal valve function and the size of a pulmonary artery. If there is an increased amount of blood flow through the pulmonary arteries, there will be a sign of VSD and congestive heart failure, because the heart will deal with high amount of blood which ultimately result into congestive cardiac failure. But if there is a decreased pulmonary blood flow, it will result into cyanosis, poor growth, fatigue, dyspnea and congestive failure. Along with these two findings, there will be a single S2. The second heart sound S2 consists of a two component, aortic component and the pulmonic component, which correspond to the aortic and the pulmonic valve closure. In truncus arteriosus, there is only one valve, so there will be a single S2. Now come toward the diagnosis, that how we will diagnose a case of truncus arteriosus. Primarily, we perform three diagnostic tests. The first one is ECG, the second one is a chest X-ray, and the third one is an echocardiography. On ECG, we will see a ventricular hypertrophy and cardiomegaly, while the chest X-ray will show increased pulmonary marking because there will be an increased pulmonary blood flow. Along with that, in later stage, there will be a characteristic sign on chest X-ray called as a sitting duct sign. You guys can see the initial X-ray changes in truncus arteriosus in this image, which is characterized by a cardiomegaly and increased pulmonary marking due to increased pulmonary blood flow. And in this image, you guys can see the sitting duct sign, which is produced as a result of a characteristic of changes in cardiac shape and the large vessel architecture, which will look like a sitting duct. The third one is echocardiography. The echocardiography is the diagnostic test of choice. It will show anatomy including the VSD, truncal valve function and the origin of pulmonary artery. It was all about the diagnosis of truncus arteriosus. Now come toward the treatment. To treat the truncus arteriosus, the ideal goal is, or the first line treatment is anti-congestive treatment. The patient will develop a congestive cardiac failure, so treat it with the help of diuretic for high volume flow. And the second option is surgery. There should be a surgery for high flow state before 6 months, but this surgery usually require a revision surgery later on in life. So it was all about the truncus arteriosus. If there is still any question, you guys can ask and stay tuned for more update.